Hello, my name is Laura Cinco, and I'm a second-year fellow in the National Clinician Scholars Program here at Penn. My rapid response COVID research project titled Capturing Wellbeing While Immunocompromised, a photo elicitation study, explored the day-to-day experiences of those at high risk for COVID-19 transmission and related complications through the use of photography. My LDI mentor was Raina Merchant, and my co-investigator was Samira Rajabi from the University of Colorado Boulder. In this study, we asked individuals who had compromised immune systems to reflect on structural changes and their emotional experiences during COVID-19 by taking photographs and sharing stories. The purpose of this was to learn more about the wellness and distress experiences of these individuals, while also learning how we can best support them going forward. 47 individuals responded to our survey. Overall, participants revealed significant distress stemming from difficult feelings, prolonged isolation, safety fears, and stress surrounding job loss or disease management. These challenges often cause mental health difficulties, leading many to prioritize well-being in their lives. Intentionally engaging in wellness strategies was often a new experience, but was deemed necessary to be able to maintain isolation for prolonged periods of time. With so much fear surrounding one's health status, participants sought to find comfort and manage uncertainty amid their socially distanced lives. This was accomplished through leaning on social support, creating routine or structure, setting boundaries, or even through reaching out to a mental health professional. Participants also sought to find pockets of escape by setting technology boundaries, spending alone time with oneself, or spending time outdoors. Looking inwards and connecting with others was also important as they move forward in their coping experiences. Prioritizing one's health and well-being was deemed essential, as our participants were aware that many unhealthy habits could form while quarantining during COVID-19. Ultimately, participants strove to build emotional resilience. This was done by practicing gratitude, finding hope, acknowledging small victories, coping with humor, and reflecting on what holds importance to them. It's important to note while most of our participants experienced negative changes to their well-being as a result of the pandemic, for some, particularly those who were severely immunocompromised from the start, not much had changed. For example, one participant shared, "Those of us who are sick enough do not get to leave on a regular basis. The world is not much different until we get outside of the home." In summary, hearing the voices of those at high risk for COVID-19 disease transmission has important implications as we move forward in these uncertain times. First, we must prioritize the well-being of those at high risk and be aware of how our adherence to guidelines really can impact the mental health and safety of these individuals. We must also think about the daily supports for these individuals outside of pandemic times, as many have had these struggles long before COVID-19 has started. While this study revealed the resilience of this group, this resilience was recognized as necessary to adapt to the community and structural failures that perpetuated safety and distress in this community. Thus, we must consult those at highest risk for infection as we begin to think of creative solutions to improve their well-being long-term, while also thinking about beginning to reopen our country. If you're interested in learning more about these people's experiences, check out our online photography exhibit debuting on Monday, September 14th. More details to come. Thank you.